Hi, my name is Diana Gasparyan, and my presentation will be on heart failure and how to distinguish the different types.
What is heart failure? According to the American Heart Association, heart failure, also known as congestive heart failure, is a chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body's need for blood and oxygen. When this happens, the heart begins to compensate in different ways. First, it begins to enlarge. By enlarging the heart chamber, it stretches more and can contract more strongly, so it pumps more blood. With an enlarged heart, the body begins to retain fluid. The lungs become congested with fluid and the heart begins to beat irregularly. Next, the heart develops more muscle mass. The increase in muscle mass occurs because the contracting cells of the heart become bigger. This allows the heart to pump more strongly. Lastly, the heart begins to pump faster. This helps to increase the cardiac output. Besides the heart, the body also attempts to compensate in other ways. The blood vessels narrow to keep the blood pressure up, trying to make up for the heart's loss of power. Heart failure is usually split into three subcategories: right-sided heart failure, left-sided heart failure, and congestive heart failure. The heart's normal pumping action moves oxygen-rich blood as it travels from the lungs to the left atrium, then on to the left ventricle, which pumps to the rest of the body. The left ventricle supplies most of the heart's pumping power, so it's larger than the other chambers and essential for normal function. In left-sided failure, the heart must work harder to pump the same amount of blood. Left-sided heart failure is also split into two subcategories: systolic failure and diastolic failure, also known as diastolic dysfunction. In systolic failure, the left ventricle loses its ability to contract normally. The heart is unable to pump with enough force to push enough blood into circulation. In diastolic failure, the left ventricle loses its ability to relax normally because the muscle has become stiff. The heart is unable to properly fill with blood during the resting period between each beat. Listed here are some signs and symptoms of left-sided heart failure, and an acronym to help you remember them. Forced: fatigue, orthopnea, restlessness, cyanosis or confusion, extreme weakness, and dyspnea. Heart failure can involve the heart's left side, right side, or both sides. However, it usually affects the left side first. The heart's normal pumping action moves used blood that returns to the heart through the veins through the right atrium into the right ventricle. The right ventricle then pumps the blood back out of the heart into the lungs to be replenished with oxygen. Right-sided heart failure usually occurs as a result of left-sided heart failure. When the left ventricle fails, increased fluid pressure is transferred back through the lungs, ultimately damaging the heart's right side. When the right side loses pumping power, the blood backs up in the body's veins. I have inserted an acronym to help distinguish the signs and symptoms of right-sided failure as well. BACONed: bloating, anorexia, cyanosis or cool legs, oliguria, nausea, edema, distended neck veins. Previous conditions can damage or weaken the heart and lead to heart failure. Some of these conditions include coronary artery disease, hypertension, cardiomyopathy, arrhythmias, and other diseases. Risk factors include, but are not limited to, hypertension, coronary artery disease, diabetes, heart attack, alcohol and tobacco use, and obesity. After a standard physical exam, doctors may order further testing to confirm their diagnosis. Some of these tests include blood work, chest X-ray, EKG, echocardiogram, CT or MRI, angiogram, and more. Many drugs can help treat heart failure. Some of these drugs are ACE inhibitors, beta blockers, diuretics, and more. In more severe cases, surgery and medical devices may be recommended, such as coronary bypass surgery, valve repair or replacement, pacemakers, and in most severe cases, a heart transplant. I hope everyone learned something new today about heart failure. And with this, I conclude my presentation. Thank you.